Right, good morning,
Yeah,
Peter. Thank you. Well, no, it's not morning there. It's afternoon, isn't it? I understand.
this afternoon. Yes, it is. It is. It is. Yes. Yes. Hi there.
And a beautiful afternoon by the looks of it. Right, I just wanted to have a quick chat with you this morning and ask a couple of questions relating to the topics you're talking about at the Biomechanics Summer School, which is
Yes, sure.
mainly treating tendinopathy and the current research behind it. So how
Yeah.
would you say that current research has changed your approach to treating tendinopathy?
Um, if you look at the research, I think what we know is that the most evidence-based intervention is exercise. So exercise, we have strong evidence for, but when you sort of strip that away and you look at everything else, unfortunately, there's not much evidence to support a lot of the other things that we do. That's not to say they're not good things to do, and we shouldn't use them for some patients. But we know that the thing that is strongly evidence-based is exercise. So I think we need to, the way that I tend to treat this is influenced by the research is exercise is the key intervention, and then we have all our other adjuncts around that. But the other thing that I think is related to that question that is really important for me and what has changed my practice recently is that a realisation that we don't need to be too hung up about exactly how we exercise people, as long as they're loading and they're progressively increasing their loading over time. And it's more about monitoring pain and making sure that their pain is improving or at least staying at the same level whilst we're increasing their load tolerance and we're increasing the loading they're doing based on what specifically they need to do for their function. So we've gone away from this view of, it has to be, an eccentric exercise specifically, or it has to be, done in this way or this, protocol. So it's much less driven by, protocol and much more about, just progressively increasing load specific to the demands for that particular patient.
Yeah, so it really is about taking a step back and looking at that patient as an individual then.
Absolutely, yeah, without a doubt, that's key. That's key.
I think you probably almost touched on my next question there, and that was going to be how soon would you start prescribing an exercise regime after you've made that diagnosis? So is that very much down to the individual as well? Yeah,
absolutely. Look, it's day one if you can, as soon as possible. As soon as you can bring something in that they're low tolerant to, that they're not flaring to, we know exercise is going to benefit them. So as soon as you can start to do that, that's going to be beneficial. And we know these days that exercise has so many varied effects. I mean, we used to think traditionally about exercise as strengthening, and we're making them stronger. But now we know we're just desensitizing the pain pathway, and we're also having multiple effects. It could be, improving their self-efficacy and reducing fear of movement. There's lots of different mechanisms that we're aware of now. So it's not just about, getting them really strong and improving their strength, but that could be part of it. It could also be that we are having other effects on the tendon as well. So these are things that I want to touch on as part of my presentation. But really, to go back to your question, yes, the key thing is start them as soon as they're low tolerance. So you can start them usually, for most patients, I would start them day one doing something. Yeah, and it's about just finding a level that they're able to do day one.
Very much looking forward to hearing you talk about that in June, certainly. So just quickly before we finish up, have you got a top tip that you can give us all that are listening?
Top tip would probably be, I think one of the key things with tendons is really about motivation. So being able to educate. And this is another thing, I guess this probably touches on your first question as well. Being able to educate patients really, really, really effectively so they understand exactly what their pathology and pain means. It is very much a motivator for them because it really reduces their fear and reduces other cognitive emotional factors that might have a negative bearing on their outcome, which we know are very important. So we sort of recognise these things for back pain, but not so much for tendons. And the case is starting to be that we are seeing, some of this education and some of the basic stuff that we do as being really important for tendon patients as well. So I guess the top tip, if there is a top tip in there somewhere, it would be go back to basics.